Welcome back to Catholic Lunch Break here on AM 1430. This is the weekly program where we catch up with all things Catholic in the greater Houston area. This is Wyatt Goolsby, the executive director of this radio station. A Houston doctor is recognized for her years of volunteer service at the San José Clinic, which is a ministry of the Archdiocese, but that's not the only nonprofit she's volunteered her time to help. Joining us here in the studio is Dr. Mary Neal. She's an OBGYN, and she's the 2023 Volunteer of the Year at the San José Clinic. Mary, thanks so much for being with us. Appreciate you coming here in the studio. Not only are you a doctor here in the greater Houston area, you're also a family friend, known your family, your daughters. Shout out to Katie and Megan, going to St. Vincent de Paul Catholic School.
So, we go back a ways.
We do. Also, shout out, of course, to your husband, Ron. So glad that you're here on the program. I want to talk a little bit about your volunteer experience and congratulate you for being Volunteer of the Year. But first, set this up for me. What is the San José Clinic for people who may not know anything about this ministry?
San José Clinic was founded over 100 years ago, and it is a nonprofit that ministers to the medical needs for people who are uninsured and underserved. So they have to have an income bracket that means that they would qualify for the services. Once a patient, ages into Medicare, then they go into that. But we do serve so many families, and it's a wonderful organization. We have both generalists who do general internal medicine. We have specialists in some of those specialty fields. We provide pharmacy services, which is incredible because some of these medications patients require might be very expensive, and it would be out of their possibilities. So, and our pharmacy staff actually apply to the pharmaceutical companies to help them get some of these expensive drugs. We have a dental clinic as well.
Tell me about your capacity as a doctor. What all have you done there, and how long have you been volunteering at the San José Clinic?
I retired in 2009, and shortly thereafter, I started volunteering. I go 2 days a week as an office gynecologist. When we have patients that are pregnant, they would qualify for under the state of Texas for care. So they go on to get care. So we just document pregnancy, and then they move on for care. We do not do any kind of surgical interventions. So those patients who would require a surgery will be referred, hopefully, to Hares Health or one of the other institutions. So, what my general day is seeing a lot of women who have, just general female complaints and just, scheduling mammograms, doing pap smears, that kind of thing.
Has it been rewarding in your time doing that to be able to serve those who otherwise wouldn't have a place to go?
Oh, absolutely. I always say that I am paid in gratitude. For these patients are so grateful for having somebody that many of them, have let their medical problems lapse because they just didn't know that we existed, and they, didn't have money to pay a private doctor to address some of their problems.
Mm-hmm. So, and credit also to the San José Clinic because they've been around now for, 100 years?
100 years.
That's
it's pretty
amazing.
Remarkable. And so we not only, deal with acute problems, but we do a lot. The general internal medicine doctors will deal with all the chronic illnesses, and they manage diabetes, hypertension, heart disease, and even heart failure.
Yeah, and credit to them because they're also working on other programs, potential things they could do with the San José Clinic to serve even more people in different capacities.
Our staff, we have a paid nursing staff, but our physicians are entirely volunteer, and that means there's many of us that are retired and would still love to be able to serve God's people and do it in a way that we've had these talents and gifts and want to use it. But there are other physicians that are still practicing full time, and it's amazing to me. Instead of playing golf, they're coming into San Jose and volunteering their time. That is really remarkable.
Mm-hmm. So that's enough just to talk about your work with San Jose in terms of volunteering capacity. But you do a lot more than that, Mary. You also have gone on medical missions as well. I believe you were telling me to Guatemala.
Yes.
Tell me what organization do you volunteer with that?
There is a local nonprofit called Faith in Practice, and it was founded 30 years ago by a very beautiful couple here in Houston who just saw a need because Guatemala is a very poor country. It had just been, in this past century had gone through a long civil war, and the government is not able to provide medical care for its people. And there's just an incredible need. So I go on a trip once a year for a week. We go to different villages, and there we identify patients who could benefit from surgery. Mm-hmm. And there's, I think now 30 or 40 surgical teams that go to Antigua. And it's a very coordinated effort to get the patients there, and they're treated with so much respect and dignity. It's a very good experience as well.
When you see all of these different patients, people that might come from poor backgrounds or otherwise wouldn't be able to see a doctor, are there certain trends, are there certain conditions that they have that you kind of flag and note, okay, this is usually something that you have to deal with?
I'm a gynecologist, so I'm there to see the female patients with female problems. So we do see, we see the usual people that are having, problems with bleeding or fibroid tumors and that sort of thing. But we see hernias. We see gallstones. We see all the regular things that we have here that, you don't think twice about because you and I, who have insurance, can go to our doctor and we get taken care of. But I saw a lady who had an umbilical hernia that was the size of a cantaloupe, and she'd had it for 6 years. I mean, that can't be very comfortable.
So like you're saying, these go untreated for years.
Of course, yes.
Wow. So you do that. Like I said, Faith in Practice is the name of the organization you do for that. You also are board member with Medical Bridges, which is a regional nonprofit that helps hospitals, clinics, and other healthcare providers in less fortunate countries. Tell me a little bit about that.
Medical Bridges, it was also founded around the same time, 25 years ago or so, by a friend, a physician who there were 3 physicians in the medical center who said, why are we throwing all these drapes away? Why, when you do a surgical case, and why that suture didn't get used and it's still in a sterile package, and why are we throwing this stuff away? So they started in their garage and just said, we can keep this for medical mission trips. So it started out being suitcase missions, where they would pack up an extra suitcase to take with them. And now it's grown to, we sent out 63 40-foot containers last year all around the world. And we're sending supplies. We have sent $10 million worth of supplies to Ukraine.
Wow. Okay.
And the other wonderful thing is when you do something good, it seems that people kind of want to get on board with that, right? And so we have a special arrangement with Texas A&M. Some of their students, engineering students and professors, I think, are even involved with this. They take the 40-foot container and they make it a mobile clinic. So they go in and put electricity in, plumbing, build it out, and then we chock it full of supplies so it gets shipped. And so we have 3 of those in Ukraine near the border that were working us. When the fighting was intense in an area, they could move that, to kind of help the local people. And it's not just, obviously it's not just the actual combatants. It's a lot of citizens that are getting injured, So that's been good. We also go to Africa and many places that just don't have the very basics.
Right, absolutely. So important, and so glad to hear about all the work that you're doing and these organizations are doing to help the less fortunate. Mary, tell me about the spiritual dimension of that. Why do you think it's so important as us as followers of Christ continue to serve those who otherwise wouldn't have an avenue to get medical care or treatment, or just for somebody to listen to them?
We are so fortunate and blessed to be born in this country where we have freedom and we have, if you're an able-bodied citizen and you want to work and you can support your family, and we don't have to be looking over our shoulder. My husband and I were in Israel when the war broke out, and that was a little scary situation to live like that. But everyone really deserves to be able to have care, and it's just how do you go about providing that? And I think most of us physicians feel that medicine's really a ministry. When you think about it, I mean, we're just ministering to some person's physical needs. And I say that we are God's hands touching people. And, clergy minister to your spiritual needs, and educators minister to our quest for knowledge. But we as physicians, the really good physicians who go into it for the right reasons are the ones who have joy and satisfaction in helping others.
Very good. Excellent. Well, it's been great to be able to hear about all the work that you do. Again, a good reminder for all of our audience also to continue to pray for all those doctors that go out there, the medical professionals, and of course all of the people that they treat all around the world. And again, we'd urge people to check out the San José Clinic as well, because I'm sure there's
Absolutely.
still a need for volunteers and other people just to help in various capacities.
Yes, I wish I were a little better. I don't speak Spanish fluently, so I need translators. We're always looking for volunteers to come and translate. The patients have certain needs that there are volunteer opportunities within the clinic.
Very good. Excellent. Well, it's been, like I said, it's been a delight to be able to hear about all of these ministries and the work that you do. Dr. Mary Neal, 2023 Volunteer of the Year at the San José Clinic. Thanks so much for taking the time to talk with us today.
Thank you, Wyatt. It's good to see you.
Yep.